Firstly, to the numbers. There were 1,965 new cases yesterday, all locally acquired. We currently have 17,199 active cases. Sadly, 5 people have lost their lives with COVID-19. A woman in her 90s and a man in his 70s, both from Moreland. A man in his 60s from Banyule. A man in his 50s from Hobson's Bay. A man in his 50s from Hume. We pass on our deepest condolences to their family and their friends at this very difficult time. 578 people are currently in hospital with COVID-19. 117 are in ICU and 83 are on a ventilator. Turning now to the tests and vaccines. So there were 73,443 tests processed yesterday. And I want to thank each and every one of those tens of thousands of Victorians for coming forward and getting tested. 41,177 vaccines were administered at our state hubs yesterday, and many thousands more were administered by GPs and pharmacies right across the state. 85% of the over 16 population have now received their first dose of the COVID-19 vaccine, and 57% have received a second dose, which is a fantastic effort. I'll now pass to Deputy Secretary Matson to provide a bit more information on the health report before returning to provide a bit more information about our exciting announcement. Kate.
Thank you, Minister, and good morning. I'll take you through some of the geography and details of the cases, as well as some exposure sites of particular interest. So, of the total cases from yesterday, we had 735 in the northern suburbs of Melbourne, with particular majorities in the LGAs of Hume and Whittlesea. In the west, we had 464 new cases, or 24% of cases, and the large majority in Melton. In the southeast, we had 533 new cases, or 27% of new cases. Again, Casey LGA has the majority of the cases in the southeast, and 6% of new cases in the eastern suburbs, or 125 cases. In regional Victoria, there were 90 new cases, or 5%. The largest numbers of those cases were 20 in Mildura, which went into lockdown last night, 13 in Baw Baw, 12 in Mitchell Shire, 8 in Greater Shepparton, 7 in Latrobe City, 6 in Greater Geelong, and 3 in Ballarat. As of last night, the communities of Moorabool and Shepparton are no longer in lockdown, but again, with those new cases, and as always, if you have symptoms, please get tested and please do ensure you're following the CHO directions in those areas as always. Last night we did make the difficult decision to go into a lockdown in Mildura, so Mildura now shares the same settings as metropolitan Melbourne. We do appreciate the decision was made quite late into the evening, but as always, we are making these decisions on the latest advice and the latest data at the time. And if there was any inconvenience caused by our late notice, we do apologise for that. But we will never apologise for taking the right public health actions to protect Victoria and Victoria's community, and in this instance, the community in the Mildura area. The short lockdown will assist us to get our arms around the outbreak and ensure, hopefully, that Mildura can again return to the same settings as regional Victoria in another 7 days. Today's 20 new cases are spread across a number of households, and there are links over into New South Wales. Our total number of active cases in Mildura is now 37, and that's up from 1 case 1 week ago. We're particularly concerned about Mildura because of this rate in case growth, and we believe there may be additional cases out there yet that we have not found. The next 7 days will be crucial for us to have a really stringent public health response, and we thank those who've already come forward for testing, and we do ask that those with symptoms come forward as soon as they possibly can, as well as anyone who has been contacted by the local public health unit or the Department of Health in terms of being into contact with a confirmed case. We ask that anyone who hasn't been contacted or anyone without symptoms, please hold back for now. Testing capacity in Mildura has been increased, but of course, we want to be able to prioritise those people at most risk. We have opened 2 new facilities and facilities with increased capacity this weekend. They are Barrett and Smith Pathology. It's a walk-through site on Langtree Avenue. And a new drive-through pop-up at the old Aerodrome Oval on 11th Street. This drive-through site conducted over 400 tests yesterday and does have capacity for additional tests. And we have sent our mobile pathology van up to Mildura, so for quick turnaround for prioritised tests. Again, please, if you've got symptoms in Mildura, come forward and get tested, no matter what that symptom is or how slight it may be. And a reminder to those in Mildura that getting vaccinated is indeed a permitted reason to leave your home. So if you are still unvaccinated, or if you have, for instance, a second dose booked, you are more than welcome to come forward and do that if you do not have symptoms. With respect to exposure sites of interest, late last night we were advised of a confirmed case in Virgin Australia cabin crew. The case was identified through surveillance testing conducted by Virgin, and we thank Virgin and their staff for continuing to remain vigilant during COVID and conducting frequent surveillance testing. They worked whilst infectious from the 4th to the 6th of October, and there were 6 flights in or out of Melbourne that were affected. Fellow crew members on those flights have been deemed close contacts. Most do live in Melbourne and will be contacted by the department. Passengers on those flights are being contacted by the relevant jurisdictions, and we've been in close contact with both New South Wales and South Australia and working closely with them to contact the relevant passengers. The details of those flights will be confirmed in today's CHO release, but they are on the 4th of October, VA219 from Melbourne to Adelaide. Again on the 4th of October, VA218 Adelaide to Melbourne. On the 5th of October, VA827 Melbourne to Sydney. Again, 5th of October, VA808 from Sydney to Melbourne. And on the 6th of October, VA1593 Melbourne to Newcastle. And again on the 6th, VA1594 Newcastle to Melbourne. With respect to our vaccination program, the vaccination pop-ups are continuing to be rolled out and have been very successful over recent weeks. On Monday, we have 4 new community pop-ups opening. One at the Hadfield Community Hall on Middle Street. Second one at Meadow Heights Community Centre on Buchan Street. A pop-up at the Australia Light Foundation on Sunshine Road in Tottenham, and the John Pandazopoulos Hall on Power Road in Doveton. All of those sites will be offering walk-ups without a booking, and all will be offering both Pfizer and AstraZeneca. And following from the hugely successful Whitten Oval pop-up in conjunction with the Western Bulldogs, how could we possibly go past the Melbourne Demons? So we have partnered with this year's premiers to run a second vaccination site, this one at the Demons' second home, the Casey Fields Sporting Complex. And both mRNA vaccines, Pfizer and Moderna, will be offered at this pop-up, and bookings and walk-ups both available. To enhance the accessibility at our vaccination centres, we will have Auslan interpreters on site this weekend at 3 sites. Anyone who is deaf or hard of hearing can walk in for a vaccination appointment and be supported by an interpreter at the Royal Exhibition Building between 8:15am and 3:45pm, the Melbourne Showgrounds from 9 a.m. to 4 p.m. and the Melbourne Convention and Exhibition Centre from 9 a.m. to 5 p.m. That's both today and tomorrow, and we do encourage those to come forward and make use of that service. Bookings are not required, and that interpreter service will be available on request. So when you get there, please just make it known that you'd like to access that service. We have six vaccination centres that do offer an on-demand service as well. So that on-demand service is available at the Ballarat Mercure Hotel and Convention Centre, the Bendigo Health Vaccination Centre, the Cranbourne Turf Club, the former Ford factory in Geelong, Shepparton Showgrounds, Traralgon Racecourse, and the Wodonga Hub as well. And may I also take this opportunity, whilst I'm on this extremely important topic, to thank the Auslan interpreters who turn up here day after day and support us at the press conferences. It's an extremely important role, and we're extraordinarily grateful and appreciative of all the work you do for us in getting our messages out to the community. Finally, one update with respect to secondary close contacts and contact tracing processes. As always, and as I've said many times, we continue to iterate our processes as the changed public health landscape makes itself known and in the environment of rising case numbers. We will always be focusing our efforts on the highest priorities and where the public health risk is most. We will continue to contact and isolate every single confirmed case and connect them to the support they need, identify sensitive settings that may need additional or increased attention where there may be risk, so health services, aged care and so on. And we'll continue to notify primary close contacts who have come into contact with a confirmed case. You know, these are the actions of highest value. We have been working with our public health teams this week, and as sort of mooted on Tuesday, we have been looking at the role of secondary close contacts. They've been able to help us remain at COVID zero throughout most of 2021, and it's been an extremely successful part of our contact tracing and our test, trace and isolate efforts. However, in this environment, we will no longer be actively managing secondary close contacts. We do ask, again, people who are confirmed cases, if they can advise their primary close contacts. Their primary close contacts, again, may choose to notify their secondary close contacts. However, we will not be actively managing them in our public health units. This has been effective in Melbourne for a while, but effectively now this will be occurring statewide. This is good news for people who are isolating as primary close contacts, because their household members will not need to isolate with them, and they'll be able to easily get the support they need, groceries, and, you know, where applicable, go to work. We still ask primary close contacts to isolate away from the rest of their household. This hasn't changed. That's always been the case, and we continue to ask primary close contacts to do so, to try and protect their loved ones and family members should they indeed become positive. Again, if anyone who thinks they've been anywhere near a confirmed case or is concerned and develops symptoms, please go and get a test. And that still remains true of primary close contacts and or secondary close contacts. A text message will be sent to our 16,000 secondary close contacts this weekend to advise them of this change and to release them from quarantine. And our public-facing information on our website will be updated accordingly. Again, there's a very important difference between someone who is known to have come into contact with a confirmed case and then someone who's come into contact with that primary close contact, and the risk is different. So this just recognises the changing risk and the changing environment that we're in. We're no longer chasing COVID zero in Victoria, and we have 17,000 active cases in Victoria at this point in time. So again, if you've come into contact with a confirmed case, you are a primary close contact and the guidelines for you are not changing. Please do, as always, stay at home and isolate for those 14 days as requested to do by the local public health unit or Department of Health who contacts you. I thank everyone again for supporting us through this outbreak and through these efforts to be able to, you know, isolate at home, get tested when you have symptoms and follow the public health advice. please continue to wear a mask, continue to get tested and get vaccinated if you haven't already. And there's thousands of appointments online if you do want to bring forward your second dose appointment. I'll pass back to the Minister.
Oh, thank you, Kate, for that update. So look, I now want to talk to you about our creative industry sector, a sector that is vibrant and magnificent and gives so much life and meaning to our state. A sector which has struggled and has sacrificed so much over the course of the last 18 months. Today's a really important day, an announcement I'm very proud to make, because today's an opportunity to provide the level of vital funding support that the sector needs to help it get through to the other side. So over the course of the past 18 months, we've all missed out on going to live shows, to festivals and exhibitions, and it's been difficult seeing our usually bustling, buzzing theatres, galleries, museums and entertainment venues closed. The creative sectors, such as live performance, were among the very first to close, and they will be among the last to viably return to business. For our creative workforce, this has meant lost work, lost opportunities and lost income. So today I'm so pleased to be able to announce a further $15 million in tailored support for our Victorian arts and creative sector. Now, $10 million of this will target key small to medium creative organisations, much loved arts festivals, and the state's major performing arts companies. Now, this will be delivered through Creative Victoria, and the funding will assist those that are significant to the cultural life of our state and continue to be impacted by these restrictions. It will ensure they can continue to operate, employ people, engage artists and plan a pathway to recovery as restrictions ease and commercial operating conditions to resume. So in addition to that $10 million, we're providing a further $5 million to go directly to individual artists, creative workers, collectives and micro businesses, many of whom have fallen through the gaps of other support programs. So this funding will be delivered through a new streamlined round of the Sustaining Creative Workers program. And it's going to comprise grants of up to $5,000 for creative practitioners, including sole traders and freelancers, and grants of up to $10,000 for creative collectives, micro-organisations and businesses. So this quick response grant program will be delivered in partnership with industry bodies, and Victorians from all creative fields and career stages will be able and eligible to apply. So the first iteration of this program back in 2020 delivered around $4.7 million through 771 program grants and involved almost 8,000 creative workers. So the Sustaining Creative Workers program will open for applications this month and details will be made available on the Creative Victoria website. So throughout this pandemic, our creative sector has shown just such incredible resilience in the face of adversity. Keeping many of us inspired, entertained, despite the challenges of venue closures, cancellations and lost work. And they have an important role to play in our social, cultural and economic recovery of our state. So this funding package will provide a vital lifeline as we progress through the restricted phases of our roadmap to reopening and start to return to the experiences that we love. It's a much needed package of support, one that I know the industry has been calling for, one that I'm so terribly proud to be able to be given the opportunity to deliver as we charge towards recovery and reopening, which is right before us. I might leave it there, but happy to take any questions you might have.
Minister, you say we're charging towards opening up, but I know the events industry in particular is very disappointed with the roadmap because it's 150 inside, 500 outside, which of course is nowhere near what they need. What they need is more certainty on bigger crowds and when.
Look, Nick, no doubt this is a really challenging time for the sector, and it has been from the start. And that's why a program like this is so vitally important, to provide important financial support at a time that they need. This is about making sure that they've got the capacity to be in business and to be operating when we open up. Look, the best way for us to get back to the way things were is to get vaccinated. And that's why it's so vitally important that everybody who can get vaccinated does get vaccinated, because that's our ticket out of this pandemic.
But when can you give them certainty about the bigger crowds, which is what they need? That they need certainty about when those big crowds they will be able to have.
Yeah. Look, I think this is very much a work in progress, Nick, and I can't give you definitive timelines now as to when precisely you're going to be able to see them open up to that level. I think, though, what I can say is that this package is going to be really important. I think that the trials that we're going to be running in regional Victoria commencing on Monday across those 6 local government areas will play a really important step forward as we start that process of opening up. I mean, look, like you, I want this to go away. I want this to be back the way it was before this all started. We've got to follow the health advice. We've got to make sure we listen to the experts on these matters. And that's why it's that ability to reopen in a progressive and a gradual way, but also providing important financial support. This is $15 million today, but it builds off nearly $500 million of support that's gone directly to the creative sector since the start of this pandemic. And we will work with the sector every step of the way to get them through to the other side, because they are so vitally important to the very well-being of our state.
Danny, you mentioned those regional trials. Have you actually picked the businesses, the 20 or so, and those 6 LGAs that it's going to be held in?
Well, I think the LGAs might already have been disclosed, but I could be wrong there, Nick. But we'll have more to say in very soon around the details of those trials.
Minister, can you give me an example of a sole trader, freelancer or micro-organisation that will automatically, give me a real world, is it a mime, is it a busker?
Well, there's two parts to the program. So there'll be money that will go directly to some of the creative organisations. So it might be, for example, the Abbotsford Convent. It might be Bakehouse. It could be the Footscray Community Arts Centre. That would be an organisation. In relation to the creative workers, it's an opportunity for those people to put forward an application to seek that funding support. And as we well know, the creative sector is a rich and diverse sector. It's a huge ecosystem of talent right on our doorstep. This is a really targeted, focused approach to people who, for example, they might, if they may not have been able to apply, for example, for business support because they're not a business. They might not have been provided support because they're not a venue. This is about artists, practitioners at the coalface being able to be accessing vital support to keep them going at a really challenging time.
Big creative productions have been asking for a few weeks for exemptions so they can get together and actually rehearse, so that when restrictions allow, they can make their performances. It sounds like some of the big ones like your Moulin Rouge have got that exemption today, or it's coming through. Are you aware of that, and do you know how many productions are going to be granted exemptions like that so they can get up and running?
Yeah, look, Creative Victoria have been working very closely with the Department of Health, and we've now been able to establish the capacity for our national performing arts companies to be able to access that rehearsal bubble. This is a really important step because in order to be able to perform your art, create, perform when restrictions open up, you've got to make sure that your artists have had the capacity to be able to train and rehearse. So this is something that has just recently occurred through the revised directions, and that will be a really important first step to enable artists to be able to come out of the come out quickly and be able to respond and get back to what they do best once restrictions are lifted.
How many have been granted that exemption?
Let the record show that...
Ooh. Sorry, I think I might have pressed something wrong there. Sorry about that.
How many have been granted that exemption?
Look, I'll come back to you with those specific details, Nick. It's a small group, but it's some of the bigger players. For example, like the Melbourne Theatre Company, the Australian Ballet, some of those large performers who play such a really important role. It's about allowing them to get back to doing what they do best. But we can come back to you with some specifics.
Moulin Rouge?
I'll need to check. I don't want to give erroneous information while I'm up here, Nick, but I'll come back to you and I'll give you those details.
Can I just ask on a slightly different matter? Putting your policing hat on, obviously you're filling in as Police Minister, still Parliamentary Secretary there. A senior police officer resigned last night. She said she was uncomfortable with enforcing the Cho directions. She's worried about the damage it's doing to police. What does it say about these restrictions if some police are coming out publicly and resigning and say that they don't even want to be enforcing them anymore?
Well, look, first of all, I'm pleased to advise that Lisa Neville's returned from sick leave, and Lisa has now resumed her substantive responsibilities as the Minister for Police. What I would say is our Victoria police officers have done a fantastic job these last 18 months. They've worked tirelessly. They've put themselves on the front line. It was a great privilege and it was a great pleasure that I was the acting police minister for 6 months, and I worked closely with the Chief Commissioner and with his team, and I was awed and I was inspired by the work that they have done every day. To this individual officer, what I would say is I thank them for their service. I don't know how long they've served for, but I thank them on behalf of all Victorians for the service that they have given to keep our state safe. Just look, in relation to those specifics, that's best directed to the Chief Commissioner. Ultimately, those matters are of an operational nature, and it'll be inappropriate for me to comment on operational matters. But I do want to say that I just really do appreciate everything that Victoria Police does and has done to keep us safe.
In your time as the acting minister, were you ever advised of officers who did not want to enforce the Cho directions?
No.
On the broader political issue, though, have the Cho rules damaged the police's reputation in the community, and has it put too much pressure on police to enforce them and to handle the protests?
Oh, no, I don't believe so. I mean, I think that the people I speak with are in awe and are inspired by Victoria Police. Our officers have done an amazing job. They have kept us safe. They have been patrolling the border. They've been working in hotel quarantine. They've been ensuring that the delineation between metropolitan Melbourne and regional Victoria is in place. They have done a fantastic role in terms of preventing the scourge of family violence. Our officers do a fantastic job, and I believe that the community really does value and respect them for what they do. Under very trying and very difficult circumstances, day in, day out, Victoria Police are doing a fantastic job to keep us all safe.
Have you heard of police calling in sick rather than having to go to the protests, which is another one of the claims?
Oh, look, I personally haven't heard that. I handed back my acting responsibilities a few weeks back now to Minister Neville. But again, I think that Victoria Police do a fantastic job, and I'm really proud to be a member of a government that has invested heavily to give Victoria Police what it needs. It's why back in 2017 we provided $1.7 billion in funding to look at employing 3,135 officers. I had the great privilege of going to a passing out parade or a graduation ceremony at the Police Academy earlier this year for that next cohort of officers to hit the streets. We as a government, we have supported Victoria Police every step of the way, and will continue to support them every step of the way because we know the vitally important role they do in keeping us all safe.
One of the criticisms as well was that there's a perception that the Premier and the Chief Commissioner are too close. Do you think that's the case, and do you think over this last 18 months with government obviously in making these Cho directions that there is a perception that the government and the police are working too closely together?
Well, I've known the Premier for many years, and I had the great honour of working very closely with the Chief Commissioner for that period of time. At every step of the way, in every engagement, both individuals have discharged their obligations with distinction. At no stage have I ever seen anything to suggest the contrary. The Chief Commissioner has behaved with the utmost professionalism at every engagement I've ever had with him, as have the Premier. So I don't agree with the assumption underpinning your question.
And what would your message be to any police officer that doesn't want to enforce those Cho directions anymore?
Oh, well, I mean, I think, again, it's not for me to be interfering in operational matters. Under Section 10 of the Victoria Police Act of 2013, those operational matters are a matter for the Chief Commissioner. But what I would say is that we stand with Victoria Police every step of the way. That's why we've provided the $1.7 billion worth of funding back in 2017. It's why we've employed 3,135 officers. It's why we've worked tirelessly and closely with Victoria Police to give them the resources that they need, and that's something we'll continue to do.
On international, the requirement for international nurses and other medical staff, do you welcome the fact that the Commonwealth is now saying they're going to try and fast track 2,000. Victoria, I understand, is waiting to get a whole lot as well and desperately needs it.
Well, I think that in the past we've always had overseas medical professionals come and work in our hospital system. That's something that was happening prior to the pandemic. It's something that's happened during the pandemic. It's something I would imagine will continue to occur post-pandemic. And it really, I think, speaks to the great success story of Australia as being a welcoming country for migrants. This country's greatest days have been when we've had that ability for people to come from right across the world to come here, live here, build a life. It's what makes Melbourne so special as a community, and we would certainly welcome those workers to come and live in a wonderful city in a beautiful state.
But doesn't it show the system is broken if we have to rely on nurses in particular from overseas?
No,
and we're 12,000 short ourselves?
No, I would disagree with that, Nick. I mean, I think, as I said in my previous answer, this is something that has happened throughout Victorian history. I think going back into the 80s, we were recruiting nurses from Ireland, and I think even the Philippines back in the 80s. There's nothing new about this. The system is performing very well under trying circumstances. I know that Minister Foley is doing an outstanding job as Health Minister, and we're providing the support that the Department of Health needs and public health needs to get us to the other side of this pandemic.
But if we're 12,000 nurses short in Victoria, and it has been for years, why hasn't something been done to fix that?
Oh, well, I don't necessarily agree with. I don't know those numbers, Nick. I mean, what I would say is that as a government, we have invested heavily in our health system. We've invested heavily in healthcare to provide the state with the necessary resources to provide the healthcare that Victorians expect and need, and will continue to do so.
Minister, are you saying that the fast tracking of these nurses and doctors' visas has nothing to do with the demand facing the healthcare system in Victoria and the shortage of staff?
Oh no, what I'm saying is that there's nothing extraordinary about this. This is a standard custom and practice. We have had healthcare workers come and work in our system for decades. It was happening prior to the pandemic. It's happening during the pandemic, and I would expect that it will continue to occur post-pandemic. That's all I'm saying.
Whether it's at federal government level, it sounds like they're kind of leading this, but also at the state level. Do you think this should have been looked at earlier? I mean, we probably knew 6 months ago or a year ago that we'd get to this stage where we'd have to open up and hospitals would come under pressure, and yet we're flying in nurses once it's already started.
Oh, look, I mean, I think that what we've done since the very start of this pandemic is make sure our public hospital system is well funded and well resourced. We're continuing to provide significant levels of financial support to the sector. We'll continue to do that to get to the other side of the pandemic. Look, probably the other point I'd make is that there is no rule book with this pandemic. It's not like we can go back in living memory and point to, the great pandemic of 75. This is uncharted territories. It's a very challenging and difficult time, but we've made the necessary funding support to our health system and our public hospital system, and we'll continue to do that because we recognise that we've got to do this to get to the other side.
In terms of the hospitalisation rate of active cases at the moment, is that tracking about where you thought it would be in the modelling, given the number of cases around? Are there more people, fewer people, about the same as the modelling suggested going into hospital? And is that expected to peak at some time soon in terms of the numbers along with the cases that are in society?
Look, I might throw to Kate for that. I think she's better placed to respond to those questions on modelling.
Yeah, the hospitalisations are tracking about where we expected in the Burnett modelling that's been released publicly, both hospitalisations and ICU.
And is that expected to, where is that expected to peak at? Are there particular numbers that you're looking at having to prepare for still, or has it changed over the last couple of weeks once cases have ramped up?
Yeah, I know that Burnett is looking at the modelling for us at the moment, and there might be something available later this week, given the case rates that we've been experiencing over the last week or 2 weeks, and I think we'll have more to be able to say on that at the end of this week as that work is refreshed.
When it comes to the secondary contacts now, when someone in a household is deemed a primary contact, obviously they have to isolate. what do you then say to those people who live or who could be secondary contacts? What do you want them to do now under these new rules?
Yes, so the change in secondary close contacts means that anyone, so you're exactly right, Nick, if I had been deemed, for instance, a primary close contact, those people who live with me and those people who might have engaged with me, for instance, even work colleagues, might have been deemed secondary close contacts if it related to the right period of exposure. Now, those people who live with me would be free to go about their business, provided, of course, that I don't develop symptoms and become a confirmed case. So those people can go to work, can go to Coles or Woolworths and get the shopping done, walk the dog, whatever it might be, they can go about their normal day-to-day life, provided, of course, that that primary close contact is isolating as best as possible away from the other members of their household.
Do you recommend, though, those secondary contacts get a test just in case?
Look, there'd be really no need to get a test, especially at the beginning. If the primary close contact develops symptoms, then absolutely you'd probably want to test the whole household. But the focus is on that primary close contact because they're the ones at most risk of becoming a confirmed case.
For families already in isolation, if they thought they were stuck there for 14 days together, they may not have been isolating as well as you might have hoped from the primary close contact. So is there a concern when you release these 16,000 odd secondary close contacts that they may in turn spread COVID?
Look, I would, if anyone is symptomatic, they're not released. If anyone is symptomatic, please go and get a test. But those secondary close contacts who are not symptomatic are free to go.
And how will those 16,000 know they're free to go, and when are they likely to be told?
They will receive a text message throughout this weekend.
So at some stage during the weekend?
That's right.
And don't go before you get that message?
Look, I mean, that will provide them with the evidence that they are free to go. If someone is unsure of their status, we would ask them to, go with an abundance of caution approach and not leave isolation. Again, the advice for primary close contacts is not changing. So that 14-day isolation period is still true for a primary close contact. It is only changing for secondary close contacts, and you should receive confirmation of that throughout the weekend.
Just over a week ago, the Premier flagged that rules for people coming from interstate who are home quarantining might change, that it might get downsized from 14 days to 7 days. Is that still on the cards? When might that happen, and where are those discussions at?
I don't have any information on that today, but we will come back on that.
Just on Mildura, you said it was 37 active cases now, and you mentioned it started from one case a week ago.
Yeah.
And you also mentioned New South Wales. Did this all come from New South Wales? Is this a spread from Melbourne into Mildura? How did this escalate, essentially?
Oh, look, I think there might be a little bit of both. There's been travel up into New South Wales where I know there are confirmed cases, as well as connections with Melbourne. So exactly where it came from, I'm not sure. Genomics won't tell us either because the strain has been the same throughout New South Wales and Victoria.
Are the reports that it's part of Indigenous communities accurate for the Mildura outbreak?
I am aware of some cases in Indigenous communities, and so the local health service is working very closely with those communities to try and keep them supported and isolated as safely as possible.
And do you have any idea what the vaccination rate amongst those Indigenous communities in Mildura is?
No, I don't have that to hand.
There are reports that some doctors are writing exemptions for vaccination quite extensively. What do you say to those doctors? What do you say to the people who are actually seeking those exemptions?
I have heard those reports. There are very specific reasons for exemptions under the CHO directions, and they relate to specific contraindications for the vaccine. So they're available in the CHO directions. The vaccines are safe. And the vaccines, they work. So, we're very well aware that, of 6-7% of our cases since July have been fully vaccinated. So from my perspective, there is no reason, unless you have one of those very specific contraindications, and there are not that many of them, please go and get vaccinated. It's the best way to protect yourself from serious illness and death and protect those that you love.
And what are the penalties for doctors that write exemptions that don't match the directions?
Look, I think there'd be, I can't speak to penalties specifically. Of course, the penalties are well outlined in the CHO directions and in the Public Health and Wellbeing Act for breaching CHO directions.
And can you give any example, the type of things that you can get exemption for? Have you got a couple of examples?
Sorry, Nick, I don't have it in my head, but they are in the CHO directions.
Do you know how many of these 2,000 nurses might be coming down to Melbourne?
No, I don't know.
Do you know, Danny?
No. Is it right, though, that the Victorian government has already applied for 200? I understand the Victorian government had already applied for 200.
I'd have to come back to you on that, Nick. I can't confirm that, but I'm happy to try and get some further advice to you on that.
Minister, can I just ask about checking of vaccinations? We're getting closer now to dates when things are going to reopen for fully vaccinated people. What progress is being made on QR check-ins, or will it be up to businesses to just ask people at the moment? Are you still expecting that? And the trial that's coming up in regional areas, is that going to be based on just checking paperwork and people's vaccines maybe in their phones and things? How will that kind of work?
Yeah, look, we'll have more to say about that very shortly. So I appreciate the trials will commence on Monday, but yeah, we'll have more to say about that very soon.
Sure. And in terms of looking ahead to when restrictions start to ease, do you think there will be a technological solution then, or will people be relying on checking by hand or writing a log, or just honesty system for vaccine, checking that people are fully vaccinated? Because obviously all the restriction easing seem to be geared around fully vaccinated people can do ABC. So will that just be an honesty system still, or do you think there'll be a solution to sort of prove?
Look, we'll have more to say about that shortly. Look, technology is absolutely going to play a critical role in terms of the reopening of our economy. It's already played a really important role in terms of QR checking. We are, though, very mindful that not everyone has a smartphone. That's why we've added additional functionality to the Service Victoria app in terms of add another or the kiosk function. But we'll have more to say in relation to the trial and the way in which we'll roll this out very, very soon.
Are you lobbying for or expecting any arts businesses in those regional areas to be included in that trial, whether it be a regional theatre company or otherwise?
Oh, well, I think on those questions, we'll have more to say about that. I'm not the minister responsible for running the trial. That's Minister Pakula, but we'll have more to say about that very soon.
And given the vaccination rate, is it now looking more likely that there will be some sort of crowd for the Melbourne Cup?
Well, I think what I would say is I just want to thank every single Victorian for going out there, getting themselves vaccinated. This is our ticket out of the challenges we're currently in. I think that in relation to what might occur when we hit those numbers will be the subject of further discussion, and we'll have more to say about that very soon, I think, Nick.
Kate, do you mind if I just ask you quickly? You said we were on track with hospitalisations, and it looks like we're on track with cases as well when it comes to the Burnett modelling. Does that mean we're still expecting around 3,000 a day come the end of this month?
As I said, the modelling is being refreshed given the numbers we've had recently, so that refreshed modelling I think will be available towards the end of this week. But at this point in time, we are on track in terms of numbers of cases and hospitalisations. But I will also remind you that there was a middle line and then an upper and lower band, and so we're still within that band.
Okay, but yesterday Brett Sutton sort of hoped or flagged that we may be approaching the peak. Is that not the case then?
Look, I'd refer you to Brett. Brett's obviously much closer to the modelling than I am, so I'm not here to contradict him.
You would have... Sorry, you go.
I was going to say, there are reports today that with our 70 and 80% double dose targets that we're running a little bit ahead, we might hit them 3 or 4 days ahead. Is that the case? And if so, what does that say about the speed that we're administering these second doses now?
Look, the second doses are absolutely the majority of the doses administered in our state hubs. So we did 41,000 yesterday. I don't have the specific breakdown of first and second doses, but I will know, the large majority will have been second doses. And it's fabulous that Victorians are moving their appointments ahead as we get more bookings into the system. And it is in the hands of all of us. If we can move our second doses forward, if you haven't got your first dose yet, please go down to your local pharmacy, your local GP, or to one of our state hubs hubs, because it is, you know, it's in all our power to bring those dates forward, and we'd love to see them as soon as we possibly can.
Is that a real possibility then, that if enough people move their appointments forward, that it might be even more than 3 or 4 days that we beat those targets by?
Yeah, I think it is possible that we hit the October 26, November 5 dates earlier if people do, you know, rush to their local vaccination sites, pharmacies and GPs, absolutely.
Will it be automatic?
Yeah.
Will it be automatic that we then hit, as soon as we hit those figures, the roadmap comes in? Is that the idea?
That's a question for Brett and for government.
Can I ask the Minister about that? Is it likely at the moment, are those thresholds still subject to grey areas? Like if we were set to hit it at the very start of November, which is the day before Cup Day, could the Chief Health Officer still say, actually, we're not going to actually bring that in until after Cup Day because that might be too dangerous? Is that a risk, or is it, okay, this date, we put it in the roadmap, we're sticking to it?
Oh, look, I think that really is probably a question for Professor Sutton. I mean, I think at every step along the way we followed the health advice, and I think it would be subject to the particular set of circumstances we would find ourselves in at that time. That would be my guess. I think that you need to make sure that you've got as much data available to you as you can before you make these sorts of decisions. So I would imagine that it would be very much a health-led, data-informed decision at that time in relation to what might occur.
And how much do you think the experience in New South Wales will guide you as well in terms of what happens once they start reopening up a lot more than they are obviously at the moment?
Yeah, well, I think when I last checked, they were ahead of us in terms of their vaccination rate, and we will watch their experience and what happens to them at that time. You know, comparable jurisdictions, comparable communities, and I think that will provide us with further guidance and advice at the time in terms of what might be the next steps.
No, I was just going to ask, is there any information that the health centre provide, or any reasoning why the case numbers in Victoria seem to be capping at a higher rate than in New South Wales? Is there any sort of reason for that that's been provided to the government?
Look, not that I'm aware of. I'll look at Kate, see if Kate's got any advice. Yeah, no, I don't have any advice on that, I'm afraid.
And there's a number of police patrolling the streets again today, bracing for potential protest action. Are you aware of anything, or what would your message be to anyone thinking about breaking the rules this weekend?
Oh, look, I mean, look at the numbers today. I mean, we've all got a responsibility. We've all got a responsibility to follow the rules and to keep us all safe. And if you don't really care about yourself, think about what might happen if you get sick and you pass it on to someone you love, or someone you care about, or someone who's just an innocent bystander who happens to contract it through a contact with you. Like, you know, I can appreciate these are challenging and difficult times for many in our community. We all have a responsibility to ourselves and to each other. And, you know, I think Victoria Police do a fantastic job. I would much rather see them doing, other work in our community rather than patrolling the streets, lest people, want to go out and flagrantly try and start a fight or, abuse Victoria Police or seek to flagrantly disregard the public health orders. I just would really encourage people to really think very carefully about the consequences of their actions as an individual and the impact that individual choices make and play on the collective. Like, it's really important. And, okay, you might just get a sniffle, but how would you feel if you end up infecting somebody who can't be vaccinated and who ends up on in ICU? Or who ends up dying? I mean, people really need to think very carefully about their own choices and the impact their choices are making on others.
And okay.
Yeah, Kate, couple more questions. Has there been a surge in cases down in the Mornington Peninsula this week? Some doctors are reporting that they're getting more positive results coming back to their clinics than they're used to.
I don't have any specific numbers on the Mornington Peninsula, but we can get that to you in the show release.
And has the Hawthorn Epworth Hospital had an exposure? Has that been listed as a Tier 1 exposure site?
I'm not aware of that, but we can get you more details on that as well.
Okay, just on the change for secondary close contacts, is that just purely a function as to where we are right now with almost 2,000 cases a day, or of the thousands that we have been isolating as secondary close contacts, were not enough of them, or what is a percentage we're coming back positive?
I don't have any specific percentages, but you're exactly right. It is more of a function of the changed environment and changed public health risk. So in an environment where we are unfortunately close to 2,000 cases a day, the public health risk isn't there in terms of secondary close contacts when you weigh it up with the operational impact of managing secondary close contacts. So we want to really dedicate our resources to primary close contacts, confirmed cases and sensitive exposure sites. Ready? Thank you very much, guys.
Thanks, guys. Enjoy your set day.